Hi, I'm Dr. Vinayak Maka. I'm a medical oncologist from Ramaiah Medical College. I would like to talk about one of the devices we have been using since almost a decade, that is ONCOassist app. So I was an early user of ONCOassist. There were a lot of tools before the ONCOassist came. This was one of the initially onco-focused app. My initial experience was to calculate Cavet's formula for carboplatin. Sometimes we would use for some risk scorings. As we know, ONCOassist has evolved just from giving formulas or calculations to a lot of tools like staging, which is very relevant for us because every time you have to cannot open a book and see the staging in front of patients. The staging part, AJCC auto-updated, very relevant, very intuitive to capture the tumor stage, node, and even prognostic grouping. So one thing is there, the staging has become more complicated than what it was. We could have remembered like a back of hand all the stages, but with now prognostic information into the staging, it is changed a bit. So this helps there. Other tool which we significantly use in our practice is the toxicity scoring. So we had CTC scoring, saying it was big book where we used to go for each symptoms. Now it is very intuitive and very easy to, like for example, if you have diarrhea, we have grades. You can just go for diarrhea and grade the toxicity. And they have made it very separate tab for immunotoxicity itself, which is good, which has even the what to do in those toxicity, which is very welcoming. Then there are a lot of other disease specific tools such as breast cancer tool. We have metastatic prostate tools, which helps us to refine our treatment goals. Not significantly using because we're not aware of it, but definitely there is becoming better. One thing early morning we try to do is to look after oncological updates from conference to latest news. They were linked with very good websites. Like for example, I used to go and see ASCO update post, what they used to say. Then I used to go for ESMO alerts. Used to keep a alert RSS alerts for those things. Now in my own app, I get those alerts. It helps to freshen up the day with some news from oncology. Those are the pain points and the solutions. And I think it can grow on you sometimes that we are able to use this apps at a very faster way. So one of the features which I think we can use more is sensitize students to use this app. We always believe in standard conservative way of reading books and other things. As this information overload, bare minimum. So minimum standards, what we call in our academic lexicon, that they should know. So these students, if they start using app, understanding principles, it will help them to read better when they go for those books. So definitely all oncological trainees, maybe from medical oncology, hemato-oncology, or even radiation oncology, definitely surgeons, which will help them to do it at a very quicker reference guide. And I don't see any much more apps coming in similar terms which can help them in the shortest time possible. That's the feedback from me for now. Otherwise, good to work with ONCOassist for long.